Alrighty, so then we'll be doing the back exam first for this today. So like always, just make sure you have the appropriate exposure, have them take their shirt off with consent, of course. So then you'll start off with inspection of the back and spine, so you'll want to start with a lateral view. So you just look up. From just looking at it, it looks like everything's pretty aligned. He has good posture. You see that the ear is aligned with the shoulder, which is aligned with the hip, the greater trochanter. See, that's lined up with his knee, and then up with his ankle, so that's appropriate. So then I'll have him turn and we'll look from the posterior side. And then we'll look for any lesions, which there are none, no deformities, no cuts or anything like that. And then looking for his spine, appropriate line, no signs of kyphosis, lordosis, or scoliosis. And then, let's see. Everything seems symmetrical with that, with the muscles. No swelling or is there any tenderness with that?
No.
No. Alrighty, so then that'll take up inspection. And then actually we'll do this. I'll have you put your hands on your hips for me. And we'll kind of go right. You have to press in. Right about there. Alright, you can let your hands down. Alright. And that appears symmetrical, so that'll be good with the inspection. So then we'll go ahead and we'll move on to palpation. So we'll move down just the spinous processes. So I'll just kind of feel up here. Let me know if I'm causing any discomfort. That can be a little bit uncomfortable. Alrighty, those are probable with no deformities. Was there any tenderness with that?
No, sir.
Alrighty, so then we'll go on and look at paravertebral muscles. So that's kind of alongside the spine. So then kind of feel down this way. Any tenderness?
No, sir.
No tenderness noted, and there's no deformities with those. So then we'll go on to the large back muscle. So we'll start the latissimus dorsi. Deformities, and then we'll do the trapezium, which will make that kind of shape. So that'll be up here. Alrighty. No swelling with that. Any tenderness?
No, sir.
Tenderness noted, so no deformities with that. And then we'll move on to the SI joint. So then I know they said in the video this was kind of hard, so we'll come to kind of down here. Sorry, I'm not going to put on your shorts. I'm just going to... So sometimes there's a dimple right there. I think that's it right there. I know they said it'll be kind of medial and down once you feel these like two bony prominences. Alright, I think that's it right there. Alright, any tenderness with that?
No, sir.
There's no abnormalities with that. So then we'll go on to test range of motion. So I'll have you step back just a little bit, and then I'll have you turn, face the wall. I'll have you bend over, touch your toes, test flexion. Alrighty. Try and do it without bending your knees. There you go.
It happened.
Alright, you can stand back up. Alright, and then you're going to kind of lean back. Sorry. Alright, that's extension. And then you'll kind of turn towards me. And then you'll kind of, without bending your knees or leaning forward or back, kind of lean that way and the other way. Test is lateral bending. And then I'll have you kind of put your hands on your hips. And then without kind of moving your entire body, just try and rotate your, there you go. And then turn the other way. Alright, that's testing rotation. Patient has full range of motion, so then we'll go and test strength of flexion and extension. So I'll have you go ahead and lay on our makeshift table. Alright, so then I'll have you raise up your feet for me. I'll kind of come down here. We're going to go all the way up. Alright, and you're going to try and, I know it's kind of hard with our couch being cushioned, but try and keep your back as flat as you can. Okay. And I'm going to look to see if there's any of curvature with that, and that'll be our grade. So it's going to slowly come down and try and keep your back as much as you can. Alrighty. And there appears to be no curvature, so that would be a normal grade, which I believe is a 9+ grade. And so then we'll go ahead, I'll have you kind of, might be hard, but I'll have you kind of go on your stomach, but have your head towards this wall for me. Alrighty, and then I'll kind of hold it back. You're gonna kind of put your hand behind your head and then lift up, like you're kind of leaning backward.
Like this?
Nope.
Oh, this way?
Yep, that way, and try and just go above parallel, so just try and arch your back up. Alrighty, and that appears normal with no abnormalities with that. So that's a 5 out of 5 against strength against resistance, and then that would complete the back exam. That's it.